What are structural differences between artery and vein? They differ in the internal diameter, the wall thickness, the relative amounts of the principal components of the vessel walls, endothelium, elastic tissue, smooth muscle, and fibrous tissue. What is distensibility? Distensibility is the ability of a blood vessel wall to expand. Distensibility is the relative change in volume per unit of pressure. What is elasticity? Elasticity is defined as the object's ability to recoil, return, to its previous shape after being stretched. What is compliance? Vascular compliance, capacitance, represent total quantity of blood that can be stored in a given portion of the circulation. Compliance of hollow elastic organs, the relationship between transmural pressure difference and volume. C equals delta V slash delta P. What are mechanical differences between artery and vein? How do these differences affect the function of artery and vein? Compliance of vein is 20 times that of its corresponding artery. Distensibility of vein is 8 times that of its corresponding artery. Vein volume has 3 times as great as artery. Veins constitute a large reservoir that contains 70% of blood in the circulation. Arteries have a low volume capacity but can withstand large transmural pressure differences. So when we compare the mechanical properties of artery and vein, we found that arteries have lower compliance and dispensability than vein. Arteries have higher elasticity than vein. Therefore, arteries can accommodate smaller volume of blood than vein. And arterial pressure is higher than venous pressure. What is the character of vascular compliance curve? It starts linear and ends flat. This means that large increase in volume is associated with very little change in pressure. But, with further increases in pressure and diameter, compliance decreases only modestly. Therefore, as volume is excessively increased, pressure starts to rise steeply. Why there is difference between artery and vein compliance curve? These disparities contribute to differences in the elastic behavior of arteries and a change in geometry of veins. What are factors that control compliance? Compliance is under the control of a number of factors, mainly 1. Sympathetic nervous input, 2. Hormones, 3. Changing components of vessel wall.